lives, antibiotics have successfully treated people with infections. Medical experts warn, however, that overusing or misusing these drugs can make resistance develop even faster. Well, as we approach the World Antibiotic Awareness Week, we thought we should invite Annemarie Blackmore, the Antimicrobial Manager from Pharma Dynamics, just to give us more information around this. A very good morning to you, Annemarie. Thank you very much for your time this morning. Essentially, in layman's terms, can you describe to us what is a superbug?
So antibiotics only kill bacteria, and if a bacteria is exposed to an antibiotic, over time it does actually develop resistance to that antibiotic. That's really naturally what happens in evolution. If we think of penicillin that was discovered around 1940, within the first decade the first resistance was already noted. But what happens with a superbug is a bacteria that has got to the point where very few or no antibiotics are able to kill it, and that is very dangerous, because that means if you get infected with that superbug, there is no antibiotic available to kill that bacteria.
Now, essentially, what are some of those dangers that are lurking around those superbugs?
Well, we have increasing numbers of superbugs being seen in South Africa. Not only in our hospitals, we're starting to see them from the community as well. There is quite a long list of them already. I think the ones that are probably quite well known is the MRSA superbug and also multi-drug resistant TB.
Now, we've also seen, and we've been told that flu, rather, is caused by a virus. Why then do we see doctors prescribing antibiotics for a sickness that is caused by a virus?
This is a big problem that we have, and it's not just locally. The problem is that the clinical symptoms of a bacterial and a viral infection are very overlapping, and it looks very similar. So a doctor has to use their clinical judgment, and the only way that they could have 100% certainty would actually be to send a sample off to a lab, but that takes quite a few days and it can be very expensive. So generally, as a first line, they will use their clinical judgment to make that decision. And I think a large part of the problem is also coming from the public, because there's this expectation, if you visit your doctor, to be prescribed a medication and not just to be told, look, I think it's a viral infection, you need to go home, you need to treat your symptoms, and you need to give it 2 or 3 days, let's see what happens.
Yeah. In most cases, we're also prescribed a probiotic that sometimes come with antibiotics. What is the role of a probiotic?
Well, what happens is that we have a lot of natural bacteria in our bodies. This is extremely important and it's very good. They live in our gut, they live on our skin. It probably makes up about 3 to 4 kilograms of an adult. But when you take an antibiotic, it's going to kill all the bacteria, the good and the bad. So the idea with a probiotic is to support your system to keep your natural good bacteria intact.
You know, for those of us that develop resistance to antibiotics, what sort of solutions does one have?
Well, I think firstly, what's important to understand with antibiotic resistance is it's not a person who develops resistance, it's the bacteria. So even if you've never used an antibiotic before in your life, if you get infected with a superbug or a resistant bacteria, you are facing the same threat and the same problem as everybody else. And it is a very serious threat. At the moment, it's estimated that about 700,000 people are dying annually from untreatable infections. This is a global statistic. And if left unchecked, this figure could rise to 10 million deaths by the year 2050.
Yeah.
Annually.
Let's just go back to the viruses. What sort of options do people have when they do have a viral infection other than being prescribed an antibiotic?
Look, depending on what virus it is and how serious it is, there are obviously antiviral medications available, which can also develop resistance over time. But if you've got a normal virus that's causing you your winter flu, you really do need to just go and treat your symptoms, but it is also very helpful to get the flu virus at the beginning of the year, because this will help protect you against those extremely bad viruses that really make you very sick.
Now, in terms of healthy eating, in terms of having a good and strong immune system, there's been a wave of eating healthy, of going vegan or going natural. Are we seeing the same effects when it comes to natural medication being able to treat viruses and bugs as effectively as probiotics as well as antibiotics?
I think when you have a viral infection and you need to actually allow your immunity to kill the virus yourself, then if you can take something additional that will support your immune system and strengthen your immune system, it can't do any harm. I just think it's important to follow the advice of your doctor, and if they do prescribe a scheduled medication that you need, which will typically be if you've then developed a secondary bacterial infection, I think it is very important that you follow the advice of your medical professional that you visited.
Very insightful. We thank you very much for your time this morning. From our studios in Sea Point, that was Annemarie Blackmore, the Antimicrobial Manager from Pharma Dynamics.